So welcome to today's webinar on rethinking vaccine confidence, supporting uptake through equitable community responses. In the next hour and a half that we have together, we'll discuss the challenges, lessons, and strategies we've heard from communities across Canada to improve vaccine uptake and ensure accessible, equitable, and community-informed vaccine rollout. My name is Claire O'Gorman. I'm a knowledge translation specialist at the National Collaborating Centre for Determinants of Health, which is one of 6 national collaborating centres for public health across Canada and are funded by the Public Health Agency of Canada. Before we get started today, I'd like to first start by acknowledging that today is National Indigenous Peoples Day. And acknowledge this at a time when the calls to action from the Truth and Reconciliation Commission are finally gaining some public attention, but only because of the immense grief and tragedy that was uncovered first at the Kamloops Residential School and continues across nations as more unmarked graves are found. So especially as we talk about health equity today, I think it's really important that we're reflective on the impact of colonialism and that we're decolonial and anti-racist in our actions moving forward. I'm based in Treaty 7 territory, home of the Blackfoot Confederacy, Tsuut'ina and Stoney Nakoda First Nations, as well as Métis Nation of Alberta Region 3. And the National Collaborating Centre for Determinants of Health is located in Mi'kmahi, the unceded territory of the Mi'kmaq people. So I welcome you all from coast to coast to coast and respectfully acknowledge that we live and work on the traditional lands of the many Indigenous people here. So just a few housekeeping items before we start today. So of course, our conversation will be recorded and shared with registrants via email and will also be posted on our website for future reference for those who are unable to attend today or if you want to refer back to it. Please ensure that your mic is muted. You're welcome to leave your cameras off. And for the best viewing, you can use speaker view. We don't have any slides. It'll be a conversational webinar today. Please feel welcome to use the chat box to connect with one another, to pose questions. And right now you're welcome to introduce yourself in the chat box. Let folks know who you are, let us know who you are. We're happy to support that conversation. We have Jamie with NCCDH here to support that conversation in our chat box today. And she'll be pulling out questions as we go. So feel free to pose them as we go along in the webinar. We'll answer as many of those questions as we can today, but certainly if we run out of time, you're welcome to pose them and we'll do our best to follow up with you as well if we don't get to all of them today. So the format of today's webinar is that we'll first go through some questions that you've posed to us through your registration. We'll hear from all of our panelists and have a conversation about vaccine confidence and uptake in our country. And then we'll move to conversations from that chat box, so please be sure to submit them. So I'll start by briefly introducing our panelists, and I'll let them share a little bit more about the work they're doing in this particular arena as we go along. So Sume is our Senior Knowledge Translation Specialist here at NCCDH and hosted our first conversation series last spring. And out of those webinars published a paper titled Back to Better, Amplifying Health Equity and Determinants of Health Perspectives During the COVID-19 Pandemic. We also have Angela Robertson here with us today, and she's the Executive Director of Parkdale Queen West Community Health Centre, which serves Mid and West Toronto. Angela is dedicated to people and communities facing discrimination, poverty, and marginalization, and has been recognized for her social justice work by the YWCA, Fred Victor Center and Urban Alliance on Race Relations, Now Magazine, and was honored by York University in 2017 with an honorary doctorate of law degree for her social justice work. Thanks for joining us today, Angela. We also have Dr. Stephanie Montesanti, and she's a settler Canadian residing in Treaty 6 territory in Western Canada. She's an associate professor and scientist with the Centre for Healthy Communities in the School of Public Health at the University of Alberta. She's an applied health policy and systems researcher leading the collaborative Applied Research for Equity in Health Policy and Systems, CARE research group. Thanks for joining us today, Stephanie.